expand that capacity when they need to. And testing for not only people who need testing, but testing for our at-risk and vulnerable populations. One of the conversations I had this morning was with our healthcare partners to ask them what we're seeing in Sioux City. Sioux City has, I think, now north of 3,000 cases just in the Sioux City area. And so how is that affecting our capacity here? Are we seeing cases come up here, and are we going to need to help the people of Sioux City? And so we're looking at those things. We're looking at what's happening in Worthington and Sioux City and other areas to make sure we have that capacity. Today, our governor's executive order for vulnerable populations in our counties, in Lincoln and Minnehaha County, is set to expire. And we'll see. I think she has a press conference there today. If that is renewed or not, we'll wait to hear from her on that. I just want to remind those individuals that are in those categories to continue to make the responsible personal decisions to protect yourselves. Whether or not that gets renewed, it's very much on you to make the right decisions for your own health care and for your own safety. You know, as expected, we saw an increase in cases over the weekend. I think last time we talked with you, Thursday of last week, we talked about that was going to be the fact. We knew that was going to be the fact. Based on the 4,000-ish tests we ran at our specimen collection site last week, and we're starting to see the results from those, we're averaging about a 22% positive rate in our MSA, and I'm going to talk a little bit about why that's important. And thankfully, our hospitalizations, they continue to remain steady. So that's important, because if cases increase but the hospitalization rate remains steady, that's what we continue to watch, and I have to always be reminding people of that. It's not case counts. It's not even deaths per capita. Those aren't even metrics. We're watching them, but what we're watching more than anything is the hospitalization rate and the positives per capita, right? And the positives, the number of cases we're running. So if we run 10 tests and we get 2 positives, if we run 100 tests and we get 20 positives, if we run 1,000 tests and we get 200 positives, that's the same rate, right? So that's what we want to see slowly declining, is that positive rate. So to a couple points on that, let's see. So talked about the percentage of positive cases. Actually had that number wrong. We're just a little north of 23% of the total tested in Minnehaha County is positive. In Lincoln, it's right around 10%. McCook 3%, and Turner County is right around 10%, for around a 22% total in our MSA. So when we talk about our MSA, we're talking about that 22% rate. What's important to look at here, I want you to focus on this. I know this is a little hard to see on camera, so let me tell you what you're seeing here. This is the positive case rate percentage, right? When I talk about what's important, this is the line we want to see going down, okay? So you're seeing numbers here anywhere from, at a low of probably 11, 12, like where we're at our most recent metric here, to all the way up to 30% of the cases being positive based on the tests. So this is a trend we're watching. It's pretty erratic right now, as you can see. This is the band of safety, really. This is where we're trying to get to. This is a 3 to 12% band. If we can get to the point where our percent positives are in that 3 to 12% range, that's a range where we're extremely comfortable. Our healthcare organizations are still comfortable with what we're seeing here, but this is what we're shooting for. So this is probably a more important metric than total cases. Okay, we had 120 new cases in Sioux Falls, let's say. Well, that doesn't mean a lot if we tested 15,000. If we tested 121 cases, then that is a big deal. So this is an important chart that we're going to be sharing with you more as we have briefings going forward, which, by the way, we'll probably end up moving to weekly briefings starting next week on this. So as we're starting to reopen in the community, and I use the term reopen loosely because that's what the national dialogue is on this. But again, Sioux Falls was never closed. No businesses were required to close. There was never any stay-at-home order, any shelter-in-place order. But businesses are starting to get back to a more normal cycle. As that's happening, we obviously, as you know, launched something called our SOAR program, which is helping those businesses open in this new environment. But we also have to start thinking about 6, 12, 18, 24 months from now.
and how do we get the economy going long term. Okay, I talked to one hotelier a couple weeks ago, and he said this is going to have a 3 to 5 year impact on his business. That's going to be how long it will take his properties to get back to a semblance of where they were even just 60 or 90 days ago. So to do that, we have worked with the Sioux Falls Development Foundation, Forward Sioux Falls, Downtown Sioux Falls, and the Chamber to join together and create a program that we're calling the Spark program. And I'm going to turn it over to Jeff Griffin. Jeff is the president and CEO of the Greater Sioux Falls Chamber of Commerce, and Jeff is going to introduce that program for you all today. So, Jeff?
Thank you, Mayor. Good morning, everyone. So, the really great thing about Sioux Falls, and for those of you that don't know, I'm just in my 4th month here in Sioux Falls, and everything that attracted me to Sioux Falls is playing out. The teamwork, the partnerships. I told the mayor I didn't need a pandemic to demonstrate that to me, but the fact that the partnerships already exist and we can build upon those is a great leap forward for Sioux Falls. So as the mayor mentioned, the group is called Spark Sioux Falls, and at the Chamber we're talking about for 115 years our chamber has existed in Sioux Falls through good times and through bad times and through the Spanish flu pandemic. So it really is what we normally do with our 2,000 members who represent 80,000 employees. But we're able to put that kind of rocket boosters on that right now with the Development Foundation, Forward Sioux Falls, Downtown Sioux Falls, and Experience Sioux Falls, and the city. We're putting together the best minds that we have, business minds, to focus on retail recovery, the restaurant recoveries, attracting people to South Dakota and specifically Sioux Falls when people do get back out and about to spend their dollars. Encouraging people this summer to do staycations rather than travel far. We may have, we know people are financially stressed, so maybe consider staying at home and doing some of the local entertainment. Also including the banks. The banks have been very responsive with the Paycheck Protection Program and are being really willing to work with our small businesses to help them recover. So as we build these triage units and bring ideas together, the huge advantage we have in Sioux Falls is a robust economy going into this crisis is going to help us rebound quicker. When I talk to colleagues across the country, I have friends in cities that are terribly in debt, and they're going to have a much more difficult struggle with this. So by using Chamber of Commerce resources, the Development Foundation resources, municipal resources, we have this broad reach that we can connect with national and even international partners to make sure we're implementing cutting edge, next generation strategies. Because this is going to be a long-term recovery and is really going to change the way we do business. I'm already talking to folks who they're adjusting their office model because they've had success with some of their employee groups working from home, and they're going to continue that. So those kind of trends could continue long term. That is it for the program. We taking questions or back to you?
Yeah, well, that's it. So we can jump right into questions on that. Maybe we'll start if there's any questions on the program for you.
All right. All right, thanks.
Thanks, Jeff.
Yes, sir.
All right, last thing I'll say on that is if you do have any questions, again, the email address we continue to use and encourage people to utilize is COVID-19 questions at siouxfalls.org on whether it's Spark program, SOAR program, any questions or concerns you have for the city on anything COVID related. So with that, I'll certainly take any questions you may have for me today.
What are you seeing as far as Sioux City and whether our hospitals will be helping patients there?
Yeah, the question was about what are we seeing from Sioux City and whether or not we have and are needed to help out with some of their patient load. There has been one patient, only one that I know of, that has been transferred up here. Maybe it's two now. As over the weekend, I think there might have been one more, so two. So the thing about Sioux City is where they're located is they do have options whether that's Des Moines has a lot of ICU capacity that we've learned, Omaha and Sioux Falls. So we're ready to help, as needed. They, as of today, are the second highest per capita COVID hotspot in the country behind New York City. So they really have climbed. We're very sensitive to that because they're in a position where we were just a few short weeks ago. So at some point this week, I also intend to reach out to their mayor and their leadership and just see if there's anything that we can provide in terms of help. So thus far, it hasn't been a big strain on our systems or our resources. All right, any other questions? Thanks, guys. Have a good day.